بالنسبة the urine, the composition, the urine is a complex fluid made of 95% water and 5% solids. It is the end product of metabolism of many cells. All the substances in urine هم موجودين in the dam in different concentrations. ولكن this طريقة is non-interventional. ما في تبراية استخدم فقط يعني the collection of the sample is سهل. We can make the تشخيص of أمراض من كلاوي from the urine. This is the percentage of samples in urine. We have قليل أمونيا. If the cupboard is شغال, إذا كبد ما في فشل من الكبد, we have 0.05% ammonia and sulfate and all those compounds. You can see about 2% is urea and 95% water. Okay. Now, in terms of the clarity or transparency, normal urine is clear or transparent. It is clear. Any turbidity will indicate.
If I speak like this, everyone can hear in the back? Yes. Okay, so I think this is better. I'm free. I don't want that. Okay. So again, before I start now, I was too much introduction. I want to introduce myself. Some of you don't know. I'm Dr. Johar Mشتاق.
Nice to meet you.
Thank you. Same here. أنا يعني أصل من باكستان. يعني ولدت في باكستان ولكن جئت من أمريكا. عشت هنا 27 سنوات يعني. جئت لبلاد الشام فرد بركة حكم رسول الله صلى الله عليه وسلم. أنا سافرت كثير في أمريكا ولكن جئت من لوس أنجلوس لهوليوود. ولكن أنا لست ممثل من هوليوود. أنا باحث لست ممثل. يعني في كل أفلام لهوليوود موجودة هنا في كاليفورنيا أكيد يعني. مايكل جاكسون عندما هو توفي يعني هو أنا في مركز بحوث بجنبه في UCLA هوسبيتال لوس أنجلوس مشفى. هنا هو مايكل جاكسون توفيت هنا. يعني تقريبا كل الممثلين يعني from the افلام هوليوود الموجود هنا in كاليفورنيا in Los Angeles يعني. So I was and I'm a باحث بالاساس يعني طبيب الباحث يعني نشرت اكثر من 60 بحوث. This is my ولكن also my doctorate is in biochemistry. My بحوث وسيعة يعني مختلف مجالات in the سرطان, in the Alzheimer's disease, in مختلف يعني مجالات in the tip. This is my يعني I have always worked in the مراكز البحوث in the East Coast, in the West Coast, in the مختلف centers. So today inshallah we are talking about the urine. أكيد يعني أنا في هذول 5 سنوات موجود هنا بدأت أتكلم عربي أيضا يعني أحاول يعني سبيل الدراسة وايد سنة فصحى في أمريكا عربي ولكن ما في ممارسة. وأنتم تعرفون يعني عربي لغة يعني مو سهل يعني إنجليزي واحد قاموس يعني قاموس المحيط ويبسترز ديكشنري واحد جلد يعني كبير واحد جلد. ولكن في قاموس المحيط من فيروزابادي لعربي 17 جلد. هذا فرق بين اثنين لغات. الإنجليزي لغة سهلة جدا يعني. So for you you know that لغة الطب is إنجليزي. نحن نعرف هذا الشيء. لغة القرآن is عربي، لغة الحديث is عربي، لغة الطب is إنجليزي. كله بحوث. So for you يعني بس you do the ممارسة you'll be learning English. and أنا ممكن بدأ أنسى إنجليزي يعني. This is the قبل I think in الفصل الماضي I was doing the شرح of سرطان to the my طلاب in كلية الطب and أنا نسيته مصطلح. أنا قلت شو نحن نقول انتشار خلايا سرطان في الدم في إنجليزي. انا نسيته ميتاستاسيس انا نسيته لماذا؟ بسبب حوالي كله عربي يعني انا وصلت لمرحله الان بدا انسى انجليزي يحتاج ولكن انتم ان شاء الله you will get the English. So we are talking about the urinary analysis, and this is one of those like the biochemical analysis are thulths of the laboratory diagnosis, and then laboratory diagnosis is thulth of كل التحاليل. We have the imaging, we have the imaging, the X-ray, the MRI, the CT scan, the PET scan. We have those the ECG and echocardiography and all those. And then we have the laboratory analysis. So we have hematology analysis, we have microbiology, and we have the biochemical analysis. So today we talk about biochemical, ولكن تركيز on urine. Okay. This is and urine gives a lot of معلومات. There are a lot of معلومات, and this is non-interventional. معناته ما في إبرة. There is no شيء يدخل في الجسم. So إلا you have a مريض you put the folic acid يعني. ولكن this is not so much. So normal urine is clear or transparent. If this is a normal urine, and this one, it means there is some mushkil here. There is a huge change here. So imma this WBCs, the pus, or RBCs, epithelial cells, bacteria, all those things. Okay, so this is the now when it comes to the form or ragua, the moderate to large amount of proteins can cause a stable white form. So this is just a comparison. So this is the B is the high concentration. This one has protein. وبالمقابل this one has bilirubin, because bilirubin is the lower of the bilirubin is أصفر. لذلك when we have the jaundice, so anything which is in bilirubin, urobilin, they have the loan. And any urobilinogen ما في لون. مثل جن لا نستطيع ننظر جن صح؟ صورة الجن. جن لا ما في لون لجن صح؟ إنسان فيه لون ولكن جنات ما في. So this is مساعد الذاكرة فايوه. دائما أنتم بحاجة مساعد الذاكرة. الطلاب أو and you will be doing the curriculum you're doing in the half after this year صح؟ يعني so you'll have مثل امتحان وطني. And if you go to the Turkey or to any other place, you will be having امتحانات وطني. So for امتحانات وطني, there are some طرق for the تدريس of the مواد, because كلية البعث علم الحديث أصعب علم الطب يعني بسبب كثير حفظ بحاجة حفظ كثير معلومات. صح؟ So for this one, the مساعد الذاكرة دائما يساعد. عندما الطالب يجلس عند غرفة امتحان بسبب ضغط في البداية وينسى كل شيء. عندما بعدين يبدأ كل شيء هو يستطيع يستحضر في المخ يعني in his brain he can see the image the صورة في هذا المرحلة مساعدة الذاكرة they are مهم جدا in the طب for الطلاب for الامتحانات. Okay, so now identification of pathological, physical, and chemical urine constituents. So we have the macroscopic analysis. You know the first by macro and micro, huh?
Yes.
The macro is physical test and chemical test. And then you have the microscopic, تحت measure. Pathological urine constituents are substances that are not usually present in urine, such as glucose, protein, ketone. So those are pathological. معناته they are بسبب مرض يعني حالات عارضية. طبيعي they are not. Okay, how to detect abnormal constituents? Urine strip. The strip is filter paper or plastic which has chemical substance coated on it. It gives color and reacts with substances, and the produced color is compared with chart visually or mechanically. And this is one of those اختراعات in طب يعني. This is one of those اختراعات where you have the يعني the معلومات يعني this is what they call the high throughput or the high technology يعني مثل this جوال is a high technology. نفس الشيء strip. This strip is a high technology you have all the معلومات on this one. So these are the results are reported. So this is the machine, for example, and this is the test strip. You just dip the strip in the urine and then look at it. It will give you all that. You just do the مقاربة with the alwan which are already given to you here, right? These are all the. So this is the consultation in the area of the test driven. You report it as small, moderate, or large, and the plus system you use is positive and negative. So here this is the table which shows you how you report. So as أطباء, the tahalil will be coming to you from the مخابر, and you'll read it, and you have to do the علاج على أساس those tahalil. So this is the plus system, the plus one, few, moderate is plus to many, three plus, and full is the field of view. Field of view is crowded by our elements. Okay, so the method is rapid, gives early indication, and is qualitative. So qualitative, it will tell you about the نوعية, not about the كمية. Not the كمية, but the نوعية. It gives you about that. Therefore, there are other confirmatory tests. You have to do it. Chemistry, microbiology, and microscopic analysis. The reaction is strictly affected by time. So to reduce timing errors and limit variation in color, automated system is used because the machine does it very quickly. The machine does it very quickly. What are the pathological substances in the urine indicate deterioration of the barrier normally separating the urinary tract or disease or metabolic dysfunction? حسب pathology, you will see. So you have RBCs, WBCs, bacteria. حسب مرض, you have this one. And non-pathological are these things. So normal solid crystals, squamous epithelial cells. These are the radiographic contrast media. For example, and so these are all the non-pathologic and the pathologic, and so you have to differentiate, do the tameez between the two. Okay, specific gravity. The outward shape you will talk about is specific gravity. It measures the urine density, the kasafa, the density of the urine, or the ability of the kidney to concentrate or dilute the urine of a bag of plasma. The specific gravity between 1 and 1.035 of the random sample should be considered normal if kidney function is normal. Possible causes of low specific gravity are diabetes insipidus, excessive, the person drink a lot of water, for example, they eat so much of glomerular nephritis is severe renal damage. High specific gravity, and those are the which can lead you to the disease, diabetes mellitus, nephrosis, fever, or X-ray contrast media. Okay, so these are the causes for the low or the high. When I was once, I remember I was قبل 25 سنوات قبل I was مريض شديد يعني بسبب الفلو. lasted 10 months. I went to the doctor. It was, I think, Swedish doctor, and he did the tahleel of my bone, and it was I was not drinking any water. And he looked at it. He said, "This is the maximum specific gravity we can get." شو مشكلة؟ I said, last of يشرب ماء. Then he said, "You should definitely." So this is saying fever resulting in concentrated urine. Because in fever, we lose a lot of water. There is surat al-talaffuz. And because of the ta'arruf and all those things, you lose a lot of water, so urine becomes concentrated. ولكن ما زال ويبقى being this one. So this is the maximum, 1.035. Okay, clinical significance. What is the clinical significance of this one? This is impossible. This is impossible, okay? Dilute urine associated with increased water intake or water diuresis. So this is the indicates average diluted water intake excretion, 1 to 1.01. This is a concentrated urine associated with dehydration, and again 1.04 physiologically impossible. that means there is a radiographic contrast media, or you have mannitol. You're given to the marid who has intracranial pressure high. You give mannitol, for example. So there it could be. So now, why they are saying this one, as a tabib, see, as a tabib, you will be working, come on, as a ضابط تفتيش طبي. This is like one of those things, right? Like مثل ضابط تفتيش. So أحيانا in the غرب يعني what they do is that they for كل موظفين when they give them قبل هم يعطيهم وظيفة هم يطلب منهم اختبار تحليل إذا هم بيأخذوا مخدرات أم لا. مخدرات يعني ده كابتاغون مثل كابتاغون ولكن هم يعطيهم خبر مباشر. هم قال فجأة نخبركم في خلال أسبوع مشان هو شخص لا ينتبه لا يوقف يعني. عندنا أحيانا هذول الشخص لا يستطيع يسوي مراقبة في التواليت. هذا الشخص في مخبره ما يرسله في التواليت ممكن هو يحط واتر في هذا القنينة. إذا هو خايف إذا مخدرات يطلع في بول بعدين هو لا يأخذ عمل. So they are saying that if someone does that and you get the specific gravity واحد, that means suspect adulteration of urine specimen. يعني this person has put the water in it. This is مستحيل for the insan to have this one. So بسبب هو يريد يسوي غش. Okay, so this is the سبب. Now بالعكس if this is عالي جدا, in that case that means there was a radiographic contrast media or the marid is in the عناية مشددة and you gave him mannitol. كمان possible. So this is the reason behind it. Okay, urine pH. Those they work together for homeostasis. The kidneys, the lungs, and the blood. They have a balance. توازن. Normal daily metabolism generates acids and bases, so the kidneys can they regulate. The kidneys do the tanzim of the pH. So here, this one, I know that this is like this, This is okay. Clinical correlation. If the pH is أقل من 4.5, this is مستحيل. This is ممكن. If the pH, this is the pain for 4.5 إلى 6.9, this is acid urine. في حموضة in the bone, and أسباب could be high protein diet, cranberry ingestion. هنا cranberry لا يوجد. So the جامعة أنا خرجت هنا Rutgers University in New Jersey, ولاية New Jersey. هنا أول مرة يعني باحثين قبل 30 سنوات يبدأ ببحوث بالنسبة cranberry is مثل الشاري هو الشاري يعني عربي كرز مثله كرز ولكن أصغر من الكرز. ولكن the cranberry this has the صلاحية to do it is حامض أكيد يعني ولكن the juice of the cranberry has the ability to treat the التهاب مجال بولية. It can do the علاج الالتهاب مجال بولية إذا الالتهاب مجال بولية مو طويل جدا يعني. They can do that. So people take that and the person يعني some people عادة they drink cranberry juice. عادة في الغرب يعني كل يوم يشرب cranberry juice. So this is one of the سبب can there is حموضة عالية in the sleep. There is long hours of sleep can also do that. So أول sample of the bowel bath sleep, it can have metabolic acidosis. So ketoacidosis, starvation, severe diarrhea, uremia or poison. So those things can do that. Some people you have an intihar, and they want to do suicide. Ethylene glycol, this is the myoglobin. في السيارات طعم of this one is, what is the طعم of this one? You know that? حلو. للأسف this is حلو. And so some people use it يعني للأسف يعني أطباء those حالات come to you in the إسعاف. So this one is للأسف this is the ethylene glycol. We put the myoglobin في السيارات يعني in the safe engine. Respiratory acidosis. Yes, respiratory acidosis. Emphysema, chronic lung disease, COPD, right? All those can also cause acid to become acidic, the urine. Urinary system disorders. UTI with acid-producing bacteria, E. coli, chronic renal failure, UTI. And 80% التهاب الجاكولية for the acid-producing bacteria, they are from E. coli. E. coli is the most common. The most common is the E. coli infection. Medications used to induce ammonium chloride, for example, they are the ammonium chloride of alkaline urine. Now, this is vegetarian diet. يعني الشخص يأكل فقط vegetarian. هاي هنود يعني. لا، مثل الهنود موجودة فيها. هم لا يأكلون لحم. ويقتل المسلمين ولكن لا يأكل لحم. عجيب يعني. هنود في الهند بوزيون. نعم. So vegetarian فقط. Citrus fruits, low carbohydrate. So this low carbohydrate. Like Imam Anwar al-Awlaki رحمه الله, what did he say? هو قال يعني الإسلام لا يمنع أكل اللحم يعني. بس نحن بحاجة توازن، بحاجة يعني تغير طريقة الحياة يعني 24 ساعة أمام كمبيوتر فقط الشخص يجلس مثلا لا يتحرك. أكيد أكل اللحم وأكل خضار نفس الشيء عندهم مشاكل.
عندهم اللحم رب.
ها؟
عندهم اللحم رب.
Yes, no. So it's not a problem. Okay, citrus fruits, low carbohydrates, they also cause alkaline urine. Metabolic alkalosis because of vomiting and gastric lavage. الآن I think عندكم في الإسعاف في قليل gastric lavage, صح؟ We have لكن قليل يعني. We have this. They can also cause alkaline urine. Respiratory alkalosis, hyperventilation, urinary disorders. Now UTI with ureas producing bacteria, Proteus and Pseudomonas. Okay. Pseudomonas يعني the opportunistic infection in the عناية المشددة, for example. Renal tubular acidosis. Okay. Now medications used to reduce, so these are sodium bicarbonate, potassium citrate, acetazolamide. Okay, physiologically impossible. This is for intravenous medication or agent. Improperly stored urine specimen. Contamination with an alkaline. So this is just the contamination. Okay. Now we'll come to proteinuria. Proteinuria, as بين from the ism, whenever in the لغة الإنجليزية you have يعني شك, you don't understand, always break the كلمة. مثل عربي. ثلاثي مجرد، رباعي مجرد، خماسي مجرد. You have يعني it will tell you about that. So نفس الشيء بالإنجليزي يعني. So this كلمة proteinuria, proteinuria, mean protein in the urea. So this will help you in the امتحانات, for example, and if you want to understand the presence of an increased amount of protein in the urine, this is often the first indicator of renal disease. Urine of healthy individuals contain no protein or only small amount. Protein is reabsorbed by kidney tubules, proximal tubules, reabsorbed. Yes, so in the urine. Large molecular weight of proteins make it difficult for them to pass through kidney because الأغلبية proteins are large molecular weight. They have كبير الحجم, صح? They have a lot of amino acids. They are polypeptides. لا يستطيع. So the main protein in urine of proteinuria patients is albumin. The main protein. If there is proteinuria, الأغلبية albumin. So these are the kind of أسئلة in the امتحانات عملي you can be asked. So say okay, there is a مريض عندك جاء مريض عنده proteinuria, الأغلبية يعني what is the تركيب of this urine يعني؟ أي protein موجود الأغلبية because in the dam what is the most common protein? Albumin. So in the urine كمان يحتاج albumin. These are the kind of things يعني when you do the دراسة of أي مواد always, because you will be يعني after this you will be doing magister, doctorate, so on, and then you will have امتحانات وطني. So always when you sit and look at the notes, always دائما تفكر كيف مدرس يسأل أسئلة. This مهم جدا because يعني انظر ويصير okay مدرس كيف هو يستطيع يسأل أسئلة. If you have the صلاحية you will be great in the امتحانات. Just انظر. Say, okay, this one is saying albumin, the main protein. Albumin معناته in the امتحان say the in the urine, which protein is موجود in the urine, and there are 4-5 خيارات in the أدمغة. One of them will be the albumin, for example. So because this is the main protein, so this is the طريقة for the دراسة of the امتحانات. Okay, proteinuria is important in detection of early stages of nephropathy and diagnosis of diabetes mellitus complications. If you have nephropathy, إما السبب is diabetes or سبب آخر, but diabetes is معروف for this one. So high protein in urine makes it look foamy. And what would be the load of this foam? أبيض or أصفر? أبيض, yes. Yeah, this is the okay. Associated with abnormal edema on the face or field due to disturbance of liquid pattern. They will have the edema, like the nephrotic syndrome. Okay, detection. We have 2 types of tests. We have qualitative tests using a test strip. A test strip. And you have quantitative. The كمية, sir. So this depends on volume and type of urine, protein concentration in urine may vary with time. Most tests are performed for urine samples for 12 to 24 hours. Most samples. Okay, and if the marid is in the janah or in the it is our sahal, if they have folly. And we know that the amr is not sahal because the intizam is sahal. Marid yansa, because you are doing it for about 3 hours. Okay, quantitative for 24-hour urine, these are the arqam. And the qualitative, these arqam are not for tables, but qualitative reference value normal? Negative. Mafi. So this is the circle. Okay. Now this is the classification of proteinuria. So whenever we talk about this, when we have this the kidney disease is acute kidney disease. We have the kidney, we have qabl kidney, and we have ba'd kidney. So qabl, there's something before the kidney, and then after the kidney, what is mawjood is masana. We have ureter and masana, and the prostate in the rijal, for example. So some of could be classification of proteinuria, and some of could be pre-renal. So this is increase in plasma, low molecular weight protein leads to increase in excretion. Normal proteins you see, myoglobin, hemoglobin, acute phase reactant proteins. Okay, what could be the asbab of this one? The shakhs هو تحت الانقاذ بعد القصف وبعد الزلزال, they have crush syndrome, yes. So this kind of thing, rhabdomyolysis, muscle injury, intravascular hemolysis, yes, infection, and inflammation. Okay, and then the abnormal protein. If the abnormal proteins are Benz-Jones proteins, in that case, multiple myeloma. Okay, because Benz-Jones protein is the kalima miftahiyya for you in the imtihan for the multiple myeloma. كل أمراض عندهم 2 3 4 أحيانا 4 ولكن الأغلب 1 2 و3 كلمات مفتاحية. أنتم طلاب لازم ارتبط those things because this أمر will يساعدكم في الامتحان. Okay? Because you see the سؤال حالة سريرية, and in this سؤال حالة سريرية there is a كلمة مفتاحية. There will be فخ, أكيد فخ موجود. أكثر من واحد فخ أحيانا موجود. مدرسين احيانا نحط فخ لطالب بعض الاسئله في فخ موجود, ولكن انتبه from the فخ and ارتكز الى كلمه مفتاحيه. So they say مريض يشتكي الى الم الجسم and all those things, and then they say when we did the تحليل وجدنا Benz-Jones protein in the تحليل, and what is the تشخيص of this مرض. So the كلمه مفتاحيه is this one, not يشتكي الم في البطن or this or that, no. So the كلمة مفتاحية is Benz-Jones proteins or multiple myeloma, or for the crush syndrome or the rhabdomyolysis, the myoglobin. These are like the كلمات مفتاحية. Okay, now renal. Okay, so درسنا pre-renal, now نأتي إلى renal أسباب. Renal أسباب, you know that we have glomerular proteinuria, بين glomerular filtration barrier is defective, allows plasma to enter, ultrafiltrate. So in this case, it can be selective or non-selective. Selective is the one where there is increase in albumin and moderate proteins and the moderate molecular weight proteins. This is selective. Yani yes, but the donor is not too much. Yani. ولكن the non-selective is in all proteins. This is أكيد بكون أكثر من this one. So both of them are كثير ولكن this one أكثر. All high molecular weight proteins. Okay, so now the primary glomerular disease, the most important is which? Glomerulonephritis. And then glomerulosclerosis and minimal changes. Glomerular damage due to, for the non-selective, post-streptococcal glomerular nephritis. Post-streptococcal, because streptococcus can cause the kidney infection. So this can do glomerular nephritis because of the streptococcus. Diabetes, mellitus, lupus, amyloidosis, sickle cell anemia, transplant rejection. All those are the ones, infectious diseases like the list is going to read. Transitory changes can be seen in the case of those are أمراض, and these ones are more of the حالات and they can be reversible. Okay, so now we come to the we have this one. Okay, now we still Mazda and the tubular. See, we talked about the glomerulus, and now we talk about the tubules. The tubular proteinuria, defective tubular reabsorption of proteins. Okay, defective tubular. So in this case, there is increase the idafa in low molecular weight proteins. Okay, in the glomerular nephritis or in those conditions, there is increase in high molecular weight. In tubular defect, what happens is the film here is low molecular weight in this one. So normally present ultrafiltrate, including albumin. So here the causes are the systemic diseases and those the cystinosis, lupus. Some of those are left of these are for that. Okay, now we come to the last one, the post-renal. Okay, the post-renal is urine includes proteins produced by urinary tract or the urine is contaminated with proteins. So in this case, we have the pus, menstrual blood, hemorrhoidal blood, vaginal secretions, and prostatic secretions. So they have no alaqa to the kilia. ما في علاقة لهم. So these are the asbab for those. Okay. Now blood in the urine, hematuria, hematology, the علم الدم, hematuria معناته is the presence of RBCs in the urine. Hemoglobinuria is the presence of hemoglobin. They cannot be detected by negative, so detection by strip or microscope. يعني عادة يعني this the microhematuria not كل حالات not بين in the from the looking. Positive result may be normal, no pathological cause or abnormal. So you can have this in the strip. You can do it. So you see, this is the gross. You know what is in gross, right?
Ayan.
Yes, the big picture. Gross hematuria is by microscopic hematuria. In the microscope. Okay, so hematuria, hemoglobinuria, and myoglobinuria. Okay, whenever you have مقارنة بين اثنين أشياء أو ثلاث أشياء، الأغلبية المدرس بالآس في الامتحان أي مواد كلها تكتب. لماذا؟ because in the جدول in the table the معلومات السهل يعني you can السهل easy to reach سهل الوصول يعني سهل الوصول، ولكن للأسف سهل الوصول لكم ولكن سهل الوصول للمدرس كمان عندما هو يجلس مشان يكتب أسئلة وينظر إلى جدول قال أيوة من هنا نأخذ. So this is the thing. So لذلك دائما and then بالإضافة the fifth is that تعرف الأشياء بأضدادها صح؟ and there is مقارنة here and there is عندهم حق يعني المدرسين عندهم حق هم دائما اذا يوجد مقارنه بين اثنين وثلاث اشياء دائما they ask اسئله الامتحان from those and those نستطيع نحفظ كمان بسبب this is مقارنه يعني this is سهل تعرف الاشياء بضابط. So the feature that helps distinguish between hematuria and hemoglobinuria is urine clarity. Okay, hematuria is often evident by a cloudy or smoky urine, whereas true hemoglobinuria is clear. Okay, myoglobinuria is associated with red or amber-colored transparent urine that remains pigmented after sulfication. Myoglobin appears to be more toxic to renal tubules than hemoglobin. This is the khatura in rhabdomyolysis in the crush syndrome. Myoglobin is أكثر من hemoglobin because it goes and destroys the kidney, so it appears to be more toxic. So the firq between the three, see the in the ألوان hematuria حتى إذا اللون ليس أحمر ولكن اللون البول will be cloudy, not clear, smoky مثل الدخان they say. Well, but true hemoglobinuria is this hematuria. True hemoglobinuria شفاف, clear. Myoglobinuria is red to amber color. مثل شاي. Okay, so this is the fun. Now, when we look at this the table, hematuria. What are the أسباب يعني the possible أسباب because as الأطباء the تحليل will come to you and then the مخبري هو يسوي التحليل ولكن as الأطباء you have to look at it and say okay this is there what could be the تشخيص because you will be doing that as الأطباء صح not فني من مخبر أو not the ممرض طبيب is the مشرف يعني هو القرار عنده so لذلك إن غرب إن مشافي إن غرب ما أعرف هنا يعني هو المسلمين لكن في الغرب عندما الشخص يموت هو فقط يعني بالنسبة للشهادة يعني فقط الطبيب يستطيع دراسة هذا المرض يعني الممرض أو الفني لا يستطيع يعطي هذا القرار يعني قرار فقط يعني الطبيب يعطي وهو يقول نعم تنفس وقف brain activity وقف heart beat وقف and they give this one so قرار فقط الطبيب يصدر بالقرار so you have to look at that so if you see that it's مكتوب hematuria and this RBC in the cell so what could be the start the kidney and urinary tract disease it's possible uronephritis pyelonephritis cystitis renal calculi tumors could be trauma appendicitis all those asbab يعني they could have medication cyclophosphamide those for سرطان hemoglobinuria if you have the hemoglobin and not the RBCs that أول شيء is intravascular hemolysis okay أول شيء you have burns and أكيد in the حروق we have the حروق بيصير قصف and all those things infection via malaria clostridium perfringens syphilis mycoplasma chemical toxicity because of those معادن exertional hemolysis يعني martial arts karate long distance running all those things so these are the asbab for the now when it comes to the myoglobinuria you can see that we have muscle trauma crush injuries you can have surgery or contact sports like American football muscle ischemia carbon monoxide poisoning can also do myoglobinuria, alcohol-induced and opera-induced muscle infection, myositis can do that. For example, statin use can also do that. Statin, muscle myopathy due to medications, myopathy like statin. Seizures can do that, and toxins like snake venom and spider bites. I think we have those in the heart, snake venom. Okay. The next one is the leukocyte esterase. Leukocyte esterase, this one is a screening test to detect WBCs in the urine. Because if you have the urine, in the bowl, bacteria is موجود and WBC not موجود. الأغلبية هل هذا الالتحاب؟ not التحام صح. It could be contamination صح. خطأ the first catch for example, or from the مريض, from the جسم of the مريض. The skin for example has so much staph aureus. So leukocyte esterase is مهم جدا. Is an enzyme released by activating neutrophils after they have been recruited to sites of infection. Neutrophils are the انغماسيين في الجسم صح. لكل infection they are انغماسيين. The first one in the خط أول. So the leukocyte esterase is released by neutrophils. So if there is التهاب, there is a neutrophil. There's neutrophil, there's leukocyte esterase. The detection of leukocyte esterase in urine has been traditionally used to detect lower urinary tract infections. Okay. So infection in kidneys or urinary tract is bacteria, it could be yeast, and all those. Inflammation in kidneys or urinary tract is acute interstitial nephritis or trauma. Those ones. Nitrate now, to the next one, is now used for screening of bacteria, nitrate. And what happens is that normally urine has nitrate. The urine has nitrate. And if the bacteria is good in the urinary tract, it will convert it from nitrate to nitrite. And nitrate has pink color. Noteworthy? Zahri. Positive tests indicate the presence of UTI. And most common infection is E. coli, after that protease and Enterobacter species. UTI occurs 8 times more often in females because of their anatomy. Catheterized male and female patients have high incidence. They have high incidence of infection. Okay, the high incidence. Not all bacteria contain the enzyme necessary to reduce nitrates to nitrite. I was in Mashfa Shifa in Pakistan. And then there was a Marid Tifl, and I was discussing with the Tabiba huna in Pakistan. I said that maybe we can do, it is hard to collect the urine for urinary tract infection. And she said, لا تفكر أن Foley catheter the catheter, the Foley catheter بسبب التناسب of the التهاب المجاري البولية بسبب the catheter in those دول is عالي جدا مو مثل أمريكا. So don't think about. So أكيد يعني if the catheter you put the Foley catheter, the chances because the bacteria يعني عندهم سيرفيس موجود بالسهولة يسافر إلى سيرفيس. So this is the المشكلة. So for that. Okay, not all bacteria contain an enzyme necessary. This is the not bacteria because there are bacteria that do not produce nitrate. So like the gram-positive Staphylococcus, Saprophyticus, and Enterococcus. Those two أنواع. معناته you can يعني لا نستطيع نعتمد على هذا اختبار فقط يعني. This one لا يكفي لحاله يعني هذا أكثر من واحد. Okay. So here the diagnostic utility is the positive test indicates UTI. If it's an infection in bladder disease, cystitis. In the kidney, pyelonephritis, urethra, urethritis. So this is in combination with leukocyte esterase assay identified urine specimen that should proceed to urine culture. See, كثير مرات واحد يعني هو لا يكفي يعني what do you call like the one test is not kafi. Okay, one test is this is the thing you see in the كثير مرات because you have to do more than one. Repeat testing for antibiotic therapy to still ongoing presence of nitrate reducing bacteria. So this is okay. So glucosuria, glucose and urea. Another glucose abnormal concentration of glucose in urine. When non-glucose sugars or combination of sugars are present, the non-specific term glycosuria. أحيانا we have fructose or sucrose in bowl. This one will لا يعتبر يعني glucose. This is glycosuria. Okay, so glycosuria. Normally glucose is reabsorbed by active transport. Okay? So normally this is reabsorbed in proximal tubules, therefore it doesn't appear. Renal threshold for glucose is approximately 160 milligram per deciliter. Okay, 160 milligram per deciliter. So glucosuria indicate that glucose concentration in the blood exceeds this amount, and the kidneys are unable to reabsorb it efficiently. Diabetes is the most common cause that causes hyperglycemia and glucosuria. The urine color in glucosuria is light yellow. ولكن في عندنا في يعني الإمكان موجود that we can have glucosuria for الشخص طبيعي. Those people you get the empagliflozin or dapagliflozin, they have urine, صح؟ لذلك عندهم التهاب diabetes مرضى القلب. We give them the SGLT2 inhibitors. They have glucose in their urine. لكن لا يتذكروا مرض. So they have as a طبيب لازم بقصة المريض أي أدويات مزمنة هو المريض يأخذ دوز المهم for you to مشان يقرر يعني. Okay. So lactose may be found in the urine of pregnant women of premature infants. And this is the of many sugars that is present. So here the diagnostic utility of glucose urine testing. The glucose read and screen for diabetes, screen for inherited metabolic diseases, and like the galactosemia, for example, all those. Or it can also screen for deep lactose. Okay. Ketonuria is the presence of abnormal amounts of ketone bodies. What are the ketone bodies? When we don't have enough ketones. I will send to I can send to the Kushwal, he will send to you inshallah. Okay, they are saying they need the 10 دقائق, so I have to finish it 10 دقائق. Okay, so now typical reference interval, these are for your معلومات. Now when you come to the microscopic examination, so this is now you want to look at those what is موجود. So the microscopic examination, there are 3 إمكانيات. You can have the casts, crystals, or the cells. Okay, so the casts are the tube shape made up of RBC, WBCs, and kidney cells. They are held together by proteins, the casts, crystals, and then the cells. Okay, this is the reference interval and how much. These are عادة on the ورقة التحليل is موجود يعني those معلومات يعني إلى يمين of those ورقة التحليل. Then what are the reference one? Okay, crystals. These are the examples of crystals. انتبه triphosphate crystals يشبه تابوت. غطاء تابوت يشبه. And the oxalate and cystine crystals. Here you have the oxalate crystals. Then we have the phosphate. So سامحوني I'm going to show you quickly because we have to finish this. Uric acid crystals. And أنا بتطبع مواد إضافية إلى cystine crystals. This is the background. These kind of sliders. These kind of sliders أنتم بحاجة تحط اطبع وتحط إلى جدار في غرفة البيت, and then كل أسبوع أقرأ those one because look at this one. This is all the معلومات background for and then the types of urinary stones and this is about the kidney stones. Yeah, all of it. In the ureter, in the bladder, and what kind of treatment we use, like the whole معلومات are موجود there. Okay, this you should use this in this طريقة for the حفظ of the معلومات because عند الامتحان you look at this صورة in your ممكن all the معلومات are موجود there. Okay, دي أسهل من كتابة. صورة قدام أسهل من كتابة. Okay, these are the cells. These are the epithelial cells. And now this one, الآن لا يريد أن الوقت لكن I would ask you when you go home for each one of those famous conditions and everything, read the clinical significance. These are مهم for you as أطباء. Clinical, because you have to do the ارتباط of those معلومات from مخبر إلى those معلومات to the مرض which you have so that you can do the conclusion. RBCs, and these are like the erythrocytes, WBCs. These are the bacteria. The bacteria they are commonly we see them, but بدون leukocytes could be contamination. These are the urinary tract infections. Okay, now after 3 slides, we have only three slides left, inshallah. So here, look at this one. the urinary tract infection could be upper urinary or lower urinary. Upper would be the kidney and the ureter. Lower urinary tract infection, bladder, prostate, or urethra. Aghlabiyya to those are the E. coli. Okay, and then you have these ones. And these are called some ascending bacterial infections. They can go from here, they can travel. Okay, they can travel easily. Here I have given these are my own رسم يعني إنما أنا كنت طالب في الكلية أنا أكتب هكذا أحفظ معلومات يعني. This is the طريقة يمكن you notice that أنا استخدمت ألوان مختلفة. Those ألوان مختلفة يساعد in the حفظ. They help in the حفظ يغير. دائما أشتري أخضر those markers يعني أخضر أزرق أسود يعني those أحمر and then تغير ألوان they help in the حفظ. So you see that the rhabdomyolysis and glomerulonephritis, this is like the, some could be, if they have it, this is somewhat weird actually. Then pyelonephritis, if you have pyelonephritis, some could be imma stone or renal cell carcinoma. علاج, RX means علاج, RX means علاج, this procedure. If there are stones in the ureter, علاج is procedure. If the stones is if the iltihab is here, cystitis, it could be stones, it could be cancer, procedure. Prostate, in the prostate it could be iltihab, prostatitis, and all this cancer is a procedure, urethritis. Okay. And the after slide, and then we will finish, this is like the mulakhas I'm giving you. Mulakhas, you print this one out and put it in your jidar in the way. Diamond put it in fork, yani. You put it تحت أطفال welcome your ikhwa come or they will take the pen and do like this. So دائما عالي شوي يعني. انت بيضرب اطفال يعملوا شو هم يحبون رسم يعني كل شيء. Okay, so you can see that this is the ملخص الآن. The urinalysis, if specific gravity, if macroproteinuria, if positive, spot protein, WBC is normal, 0 if 50 إلى 100, impressive, more than 100, UTI, أكيد. Nitrate, gram negative rods, leukocyte, squamous cell. This is the glucose is positive, then diabetes mellitus. Ketone positive, diabetic ketoacidosis. Okay. Then bilirubin, murtafe means bile duct is closed. Now here, the cells RBCs in ending. Asbab kasi, WBC is infection. If the acute interstitial nephritis, you have eosinophils in the urine. Eosinophils, if you have in the urine, that means acute interstitial nephritis. Causes, RBC causes, glomerulonephritis. WBC causes, acute interstitial nephritis. And in pyelonephritis, you have granular causes, which is the acute tubular necrosis. And the crystal, you go to the pathology. Any questions? سامحوني انا اوريدي يعني اشرح اكثر ولكن عندنا فيه